Today we're going to talk about the top 5 basic healthcare terms you need to know. HAAM has crunched the data and would like its members to know more about the following terms. Premium, copayment, also known as copay, deductible, coinsurance, and out-of-pocket maximum. We will define and give examples of these 5 healthcare terms. Keep in mind, your individual health insurance plan will dictate how these terms affect you. Therefore, please reference your healthcare documentation to learn more about the amounts of each of these terms for your plan. Let's get started.
What is a premium? Your premium is the monthly bill you pay to have insurance coverage. You will still need to pay your premium regardless of whether you use a plan or not that month. Think about paying your premium as you would paying your rent. Even if you don't stay in your apartment every day, by paying rent you guarantee that you have access to the apartment if needed. What is a copayment? The copayment is a flat fee for using certain healthcare services, like visiting your primary care physician. The amount of the copay is determined by your insurance plan. For example, your copay for visiting the doctor's office for an appointment could be $15. Your copay can typically be found on your insurance card. Here is an example of what that may look like. As you can see, there are a list of copays with the cost depending on the service you use.
What is a deductible? A deductible is the amount you pay for covered healthcare services before your insurance plan starts to pay. Note, this amount does not include copays or premiums. Also note that many plans pay for certain services like a checkup before you've met your deductible. Some of these services are either completely covered or only include a copay. Check your plan for more details. To clarify, services like surgeries, lab tests, MRI scans, and many more would count towards your deductible. Fully covered services like a checkup would not count towards your deductible, along with your monthly premium and any copayment amount. For example, if your plan has a $1,000 deductible, you pay the first $1,000 of covered services yourself for that year. The deductible will reset yearly. Therefore, you'll once again need to pay the first $1,000 of your covered services for each year. After you pay your deductible, you only need to pay for copays or coinsurance for covered services. Reaching your deductible does not affect your monthly premium.
What is coinsurance? Coinsurance is how much you owe for a covered healthcare service or prescription after you have reached your deductible. This amount is calculated as a percentage of the cost of the service, like 20%. Unlike copayments, which are a fixed fee, coinsurance varies based on the cost of the total service. For example, after you have reached your deductible and you visit the doctor, your insurance indicates that the amount for your doctor's visit is $100 and your coinsurance is 20%. You are expected to pay $20 for your visit and your insurer would pay the remaining $80.
What is an out-of-pocket maximum? Your out-of-pocket maximum is the most you will pay for healthcare services in a year. Your monthly premium and copays are not included in this amount. Good news! After you reach your out-of-pocket max, your insurance pays for the remainder of your covered healthcare services for the rest of the year. Remember, expect to still pay monthly premiums and copays at each doctor's visit. Keep in mind that you will never stop paying for coverage. Here's an example. Imagine you had a surgery that cost $10,000. Your deductible is $1,000. Your coinsurance is 30%. And your out-of-pocket max is $3,000. So how would you pay for this surgery? You'll first need to pay your $1,000 deductible. Then you would pay 30% of the remaining $9,000. So that would be $2,700. Your insurance company will pay the remaining 70%. So your total for your deductible plus your coinsurance would be $3,700. But since your out-of-pocket max is $3,000, your insurance pays all the covered costs above that amount. So you would only need to pay $3,000, and your insurance would cover the remaining $7,000.
Today we have defined premiums, copays, deductibles, coinsurance, and out-of-pocket maximum. As an overview, premiums are the monthly cost of having access to insurance, regardless of whether you use the plan or not. Copays are the flat fees you pay when visiting certain healthcare offices. Deductibles are the amount of money you are required to pay before your health insurance will cover your healthcare costs. Deductibles do not include the copay or the monthly premium. Coinsurance is how much you owe for a covered healthcare service or prescription after you have paid your deductible. This amount is calculated as a percentage of the cost of the service, like 15%. And out-of-pocket maximums are the amount of money you pay for deductibles and coinsurance within a given year before your health insurance starts paying for all covered expenses. An out-of-pocket max does not include your monthly premiums or copays. For additional coverage of these terms, plus many more, please visit healthcare.gov's Glossary of Healthcare Terms or hioscar.org's FAQ on handy definitions of healthcare terms. If you have any additional questions about what we have gone over in this video, feel free to contact HAAM at support@myhaam.org.
Thank you for watching!